Thank you. Good morning. My name is Ansley. I'm a surgery resident at Atrium Health in Charlotte, North Carolina. I'm hoping to do a surgical oncology or HPB fellowship in just a few years, and I am presenting my HPB research team's project on exploring the ability of radiomics to predict oncological response of colorectal cancer liver metastases to neoadjuvant chemotherapy. We have no disclosures related to this presentation. So deep learning has been effectively applied across domains of the health sciences to generate predictions from discrete inputs. As a form of artificial intelligence, deep learning cross-sectional imaging makes use of a neural network to generate clinically relevant predictions from discrete data inputs. This particular study employs deep learning on pre-chemotherapy cross-sectional imaging to predict patients' response to neoadjuvant chemotherapy for colorectal liver metastases. This may have implications for the choice of neoadjuvant chemotherapy and surgical treatment planning for this patient group. So patients with colorectal liver mets who underwent colorectal and liver resection after neoadjuvant chemotherapy were generated from a retrospectively maintained institutional registry. 2 machine learning modules were trained. The first was imaging only, and the second we added clinical parameters. Both models were benchmarked against a binary response variable according to the RECIST criteria. A receiver operating curve was created, and the resulting area under the curve was determined. And just a deeper look into these models, for the imaging model, we trained an attention-based multiple instance learning model on imaging data extracting using TerraRecon to predict the response to neoadjuvant chemotherapy. And then for the clinical model, we used logistic regression in conjunction with clinical parameters to predict the response of neoadjuvant chemotherapy. These are the parameters that we looked at. These parameters are all based on the Fong risk score. 95 patients were included for this study. Average age was 54 years, 44% of patients were female. Over 89% of patients underwent 5-FU-based chemotherapy with oxaliplatin and or irinotecan, and 59% of patients were categorized as responders to the chemotherapy. The table on your right lists the sensitivities, specificities, positive predictive value, negative predictive value in area under the curve for both models. If you'll note here, the imaging model outperformed the clinical model in each of these categories. So our conclusions: the clinical model did not meet criteria for a strong machine learning module, but a deep learning module trained on imaging data alone did outperform the clinical model across all performance metrics, and it shows the potential for the prediction of response to neoadjuvant chemotherapy in colorectal liver metastases patients. Next steps include using larger patient cohorts to determine whether imaging-based deep learning models alone can predict the response to neoadjuvant chemotherapy in patients with colorectal liver metastasis. And this will ideally help guide whether patients get chemotherapy up front or they go straight to liver resection, or how we treat these patients better. Thank you for listening to me. I'm happy to take any questions or partake in discussion.
Thank you.